one of the things I'm going to discuss right now is the issue of the complexity of the TM joint. As it turns out, the TMJ joint is the most complex joint in the body. At least that's our opinion here. And we feel that in order to be knowledgeable and know how to treat the joint, education is paramount. So we're continually taking classes, advanced classes, and even teaching some courses around the country to help educate other doctors and dentists regarding the difficulty of treating the TMJ joint. I'm a firm believer that vast majority of people do have TMJ, but it's in homeostasis with the rest of your body. Your body's compensating and just keeping it under wraps by helping you relieve the pain and just adjust to the TMJ symptoms you have, and you really don't realize you have them. And the fact that it's there, and for example, in this economy thing, in 2011, there's so much stress and anxiety that people have with their costs and if they're going to be fired, laid off, paychecks, etc., that we see more and more TMJ cases now than we've had in years, and it's all brought about by stress. So, and as it turned out from our testing, we find that vast majority of the people had underlying TMJ symptoms for years, and they were ignored, or they were at such a low level they didn't realize there was anything could be an issue. Then all of a sudden they start getting serious pain. They come in and say, I've only had pain for 2 weeks. And I go, all the data I'm getting through our examination shows us you've had TMJ for 15, 20 years, and they never realized it. So it's a very serious condition, very complex. So getting back to the education is that when we trained, it was almost a 3-year program to learn how to adjust and treat people's symptoms. There are a lot of classes that doctors are taking. They're basically weekend courses, and they come out and treat TMJ. You just have to be very careful on who you allow to treat you. We had a patient came in yesterday, lovely lady. She's been treated for the last 3 years. People are adjusting her bite, making her appliances, and everything keeps getting worse and worse because there's a basic foundation that's missing. You don't adjust someone's teeth or do anything permanent until you know what the cause of the problem is. And what's happened with this patient is she'd have her bite adjusted on Monday, it would feel great for a couple of days, then all the symptoms come back, usually worse by Thursday or Friday. And you need to be stabilized with an appliance that would get your jaw to work and your teeth to work correctly first. Once your bite is stable, with a removable appliance that there's no permanent changes to your system, that's when you can start treating a patient with permanent ramifications. So we believe that the education is really important. Thinking out what you should be doing and how you should be doing it. The internet's available. We recommend to all our patients to go on the internet, do searches, check what is being recommended to be done to make sure that it really makes sense and it's been done and it's being done in an order that makes sense. It's like you don't build a home without a blueprint. When you have proper treatment in advance, it's all temporary. It's like a blueprint, it's a roadmap of what you're going to do and how you're going to do it. Just to start taking some marking paper and placing it in your mouth and bite down in the high point they adjust. Well, you had to adjust that one high point, and the next day the high point's on the other side because the system hasn't been dealt with. The TMJ is very complicated, very complex, and it really involves the entire head, neck, and upper back. All the upper back muscles attached to the base of the skull, the neck muscles attached to the skull, all these areas come into play. It isn't just one little point that needs to be adjusted. It's an entire system that has to be evaluated. It all goes together, it works together, and to be healthy and happy, you need to have a plan that goes step by step by step. The majority of our TMJ patients are in treatment for a minimum of 3 months. And like I said previously, even 6 months to a year, year and a half, before everything is really stable and before we can do any kind of permanent treatment. The TMJ joint is so complex that it's usually totally non-diagnosed or misdiagnosed. We've had just dozens and dozens of patients over the years come to us that have gone to ENTs, chiropractors, physical therapists. They've had CAT scans. Everything in the world has been done. And it's kind of good for me because when I see that history, I know the only thing that it can be is TMJ. There's nothing else. They don't have tumors. They don't have, hairline fractures in their bones. They don't have, different neck issues that can cause all these pains and discomfort they're having. It really boils down to they have TMJ and we have to go treat it. And one of the things that also differentiates us from other practices is that when we treat TMJ, what we're really doing is treating it by going after the cause of the problem, which is really critical. The vast majority of people that are treating TMJ are doing something really mild, maybe with an appliance, then they're telling you go on a soft diet, use cold packs or warm packs, take some Advil, don't, nothing chewy, no gum, and then all of a sudden, they're really not getting treated. All those things treat symptoms, and symptoms don't solve the problem. You have to find out the cause of the problem. When you get the cause found and deal with the cause, the symptoms do go away. And that's how we treat. Cause, symptoms, resolve. It's really critical. And when you are looking for a TMJ doctor, really make sure that they are working with that mentality. It's common sense, it makes sense, and that's the way we treat people. If it doesn't make sense, we're not going to do it. Since bioaesthetic dentistry is really treating to optimum health, it's not just repairing a broken tooth that they come in. In most instances, there's a reason a tooth breaks. In most instances, there's a reason teeth have crack lines and fractures. And usually it's some type of bite issue or clench and grind. There's something going on in your system that's not healthy and causing these symptoms of broken teeth and worn teeth and grinding and clenching. So we find out what that is, we deal with it, we treat it. Then when we fix the symptoms, the bad teeth, they last. They don't break, they don't fall apart. We're treating to optimum health. In dentistry, we basically are trained to repair teeth, which is great. There are a lot of people, that's all they need. But there are a lot of people where your dentistry is constantly breaking, falling apart, porcelain's breaking, crowns are falling out, teeth are fracturing, and you just keep going on this line, of this slide of going downhill where nothing is ever stable, nothing's ever getting corrected for a long period of time. There's always something wrong, something breaking. There's some disease process going on. And with bioaesthetic dentistry, when you find the cause of the problem and you correct it, all these symptoms go away, whether it's headache, facial pain, great many times migraines, or just broken, worn down teeth, bridges breaking, implants failing. It all has to do with getting the bite right, the TMJ joint healthy, and restoring it in a healthy bioaesthetic manner. We treat to health, and that's really critical. Lastly, we have a lot of patient testimonials on our website. Feel free to go to the website and listen to what our patients have to say about the way we've been treating them over the years.